Father, thank you for today. Thank you for your watch care over us. May we be productive.
Sasha Black Fox Qualls. Danny Callison. Here. Julia Coates. Here. Joe Deere. Kevin Easley. Here. Lisa Hall. Here. Johnny Kidwell. Here. Darrell Legg. Here. Cody Poindexter. Joshua Sam. Here. Mike Shambaugh. Here. Melvina Shotpouch. E.O. Smith.
Here.
Condessa Teehee. Victoria Vasquez. We have a quorum.
Thank you, Shelley. On to reports. The Claremore Service Unit is normally manned by Mr. George Valier. Substituting for him today is Mr. Carl Murray. Welcome, Carl. Oh, minutes. Hold on just a sec, Carl. I messed up again. I'd entertain a motion to approve our minutes. Second. All opposed? Aye. Motion passes. Okay, it's all yours, Carl.
Thank you. All right, perfect. George is at a funeral today, so you're going to have to put up with me, but thanks for the invite. I appreciate it. You should have the report, I believe, that we submitted. If you have any questions on it, I'll be happy to answer or, of course, go back and get those answers if I don't know them. A couple hot topics at the hospital right now. We had nurses attend Rogers State University Nursing Career Fair in February. Had multiple healthcare facilities come around. We've partnered with Rogers State quite a bit considering their location to the hospital, and it's a good source of recruitment for the hospital to bring nurses down. The students that are familiar with us have a tendency to come down and apply for jobs. So we completed a simulation in our OR last week. We had a vendor come in, Lardale's the name of the vendor. They come in and they do simulations on many things in your OR. Specifically for us, we had them do a malignant hyperthermia and a fire in the OR. So how would we react if one of those happened during the procedure? So that went well. Our Claremore Indian Hospital Employee Association delivered homemade Valentines to the Cherokee Nation Veterans Center. These were completed or delivered on February 9th. The staff get to do this annually. Really look forward to developing those and delivering them, so that's always a fun activity we have at the hospital. We partnered with Oklahoma Highway Patrol for Narcan. I think we delivered over 200 doses last month for them to distribute out to their officers in case they need it for a opioid overdose. And then the Public Health Officers Commissioned Officer Association donated 247 pounds of clothing to the local Veterans Center. That was at the beginning of February. We started a fluoroscopy project in the radiology department. That's essentially a fancy x-ray machine. We took out the old one last week. We're going to do a remodel of the room and bring in a new fluoroscopy machine. That's going to be about a 3-month project by the time the old one comes out. The room is torn down to the studs, new supports in, and then bring the new machine in. So that will impact care a little bit, primarily through the ER. We route a lot of patients through the fluoro room for x-rays. If it's something we can't do on site, we'll have to refer them out. So if you hear anything about that, that's going to be about a 3-month project, but in the end, we should have a fluoro machine with significantly more capabilities. Oklahoma Healthcare Authority recognized Claremore Indian Hospital in February for their work towards a food pantry. I'd like to say this is a little bit premature to get recognized, but we are moving towards building a food pantry at the hospital in Claremore where we can identify patients in need, or families in need rather, and provide dry foods to them. So something we're working towards. Wanted to mention it because you might have seen it in the news. We don't have it up and running yet, but hope to by the end of this year. And then lastly, we've gotten a few questions about primary care providers. We've had 2 providers leave us in the past couple months. One took a new job and another retired. We have 4 primary care providers in our adult medicine clinic, so that's 50% of the physicians. Of course, we do have mid-levels working with those teams as well. We knew they were leaving, so we began recruitment and are in the process of hiring more physicians, 2 additional. and also brought in 2 locums to kind of bridge that gap that started last week. But all that said, there's a little bit of a delay if somebody's trying to get assigned a primary care provider in our medicine clinic right now. So just be aware if you and your constituents are asking why they can't get assigned to a team, or maybe they can't get in as quickly as they usually could. We're a little bit short-staffed. That hit us all at once, but we're working through it. Any questions?
Questions for Carl? Victoria?
Not a question, but I would like to speak with you after the meeting about a PRC issue.
Yeah, absolutely.
Thank you.
Anybody else? Thank you, Carl.
Thank you. Appreciate the time.
From Cherokee Nation Health Services, Dr. Steve Jones.
Good afternoon.
Afternoon.
Seems like we were just here a week or 2 ago, it seems like. I think the last one got delayed a little bit, so these reports came a little quicker. Your report's in my packet, or in the packet, my report's in your packet. If there's any questions on that, I'll entertain those at the end. A few things I wanted to kind of talk about. I think I gave you a construction update last time. Everything's still moving according to schedule, even though we've had some weather concerns. I haven't been made aware of any delays. We're still on track for the final. I think they bumped up some labor, brought in some other teams to keep us on track. So the hospital's moving along great. I think we're starting to see iron come out of the ground at Salina, and seeing that thing start to come up after all the complicated utility move and stuff that we went through there. You should have also received a Healthy newsletter. That's our quarterly letter that we give out from Health, so it kind of tells you all the things going on and the accolades and the accomplishments from our staff, and hopefully you've got a chance to review that. We send that out quarterly. The last thing that I do want to comment on a little bit here, because I know there's been some, you guys have been involved in funding some things for some partnerships. We've got several partnerships that are in place right now. You know, when I came into this job, Chief Hoskin challenged me with increasing access, increasing our service lines, and making more things available through our health system. So one of those has been Mercy, and you've heard a lot of talk about that. They're going to be building a cancer treatment center just across the border in Fort Smith. We are going to be partnering with them in more ways than just that, but in our health system for some more oncology care or cancer care. That's not something we've ever offered before. We're in the very first primary stages of developing what that looks like. How can we offer that access to the care to our patients where they're at? And I don't know for sure how that's going to develop. We're looking at telemedicine options and things of that nature to allow oncologists to have access, or our patients to have access to oncologists, even in our very rural clinics. So that's a big thing that we're working forward through, and it's just some of the fruits of the partnerships that we're starting to explore and get more solid. The other one is with OU Stevenson Cancer Center. We've had a relationship with them in the past. We've strengthened that relationship. They really focus on patients that are past conventional care with cancer research, experimental care, and things of that nature. So we're hoping to open some doors there with them and offer some more different types of oncology care for our patients. We know that's a huge need. And through that, we've been able to have some very good conversations with the leadership there at OU. We've started some talks around bringing some more educational opportunities to our campus in Tahlequah through their allied health program and some things like that. Again, very preliminary stages of that. We've had some very good conversations. We're hoping to expand on those conversations and possibly bring some of that training and partnerships with OU to many of their College of Nursing, College of, they have radiology college there at the Health Science Center and some things like that. We need those type folks to be trained and work in our communities. And sometimes those are very hard to find. So we're, again, going down that same path of, if we need them, let's build them and train them ourselves. And then they'll stay where they're trained and where they're from. So we're exploring some opportunities there, and you'll have more information and more to come on that as we move through it. So just wanted to give you a little update on some of the things that we're doing that are kind of outside of the lines of what we normally talk about here, and let you know that things are evolving and our health system's evolving in various ways. That's going to give us an opportunity to be uniquely positioned for the future of Cherokee Nation and all of northeastern Oklahoma, outside of our reservation even. So we're working very hard on that. With that, I'll turn it over to questions. Chair?
Well, moving into oncology care, that's quite a leap.
It is,
For
but
us.
it's something that, we do it, we spend a lot of money with our PRC money on oncology care. So, and a lot of people are displaced from their home when they're going through treatment and having to go and meet with their oncologist. So we're looking at ways to, again, with our mission of trying to keep people closer to their community and close to their home, how can we bring that care to them? And that's what we're exploring.
Any other questions for Dr. Jones? Mike?
Real quick, have you looked at medications? I know we don't provide a lot of cancer medications, but that's becoming a very, very big deal for our citizens, so we really need to look at that. Have we thought about that?
That's a very difficult conversation because those medications change very fast and evolve, and they don't have a very long shelf life, or they require compounding to make those medications, which we don't do. But we do have our patient benefits coordinators, and those folks help us to find resources for people when they don't have the resources to get those medications. Many times those drug companies will work with us to provide those medications at a very, very, very small cost, and sometimes for free. So we work very hard to do that, and Melvana can tell, Counselor Shop-Hatch can tell you about that because she's been in that field. So that's something that we focus on a lot, trying to help those patients that don't have any third-party payer to come up with the money to do that.
Well, that would be good. Do you have any idea how many of our citizens actually are affected by cancer? Have you ever, in our health system, have you looked at that?
I don't have that number off the top of my head. We do keep numbers all the time on how much we spend, and that's kind of what drives us, is when we look at how much money is going out the door with contract health or purchase referred care, that's how we prioritize the direction we need to go. Because as we grow our health system, every time we hire another doc, every time we start a service line, that creates more and more referrals because we're bringing more and more people into our system. So we have to look at that and say, okay, this is an area where we're spending a lot of money. It's an area that shows a huge need. People are being displaced, so it became a priority to try to find answers for that.
Well, but if you don't know how many people are affected by this, and you know that you're not being able to provide a service to them, you really don't get a really good feel about, out of all the people that have this, are afflicted by this, and we obviously are paying this, you don't get a look at what you're not paying and not helping them with, though. So if you could just see how many people in our nation have this affliction of cancer, it would just be interesting to see.
Yeah, and I don't want to say that we don't know that number, because I'm sure that we through our health records, anything with a diagnosis, we can pull out that information. I just don't have that information off the top of my head.
Well, you get
Yeah.
that next time, it'd be interesting to see. All right, thanks, sir.
Okay, thank you, Dr. Jones.
All right, thank you.
Miss Lisa Pivick from Public Health.
Good afternoon. It's good to see all of you again today. I agree with Dr. Jones. It seems like we were just here a couple of weeks ago, but it's always nice to see all of you. You have the public health report in your packet, and happy to address any questions. I think there are a few things that I probably need to review with you today to get you up to date on, and questions that I have coming in around a couple of things that are going on within public health. You'll see within your packet, during the month of February, we are doing outreach around Heart Month, American Association Heart Month. We're doing activities in various communities around hypertension, heart walks, a variety of those activities going on. And as you know, in March every year is when our wings races and wings and walking clubs start again. So you'll be seeing those starting up pretty quickly, moving through that pretty soon. And I did mention last month that we are working on a push to do a lot more in the area of smoking cessation and tobacco abuse, so you'll be seeing more things coming out with that. We are working very hard right now on farmers market for this summer. Last year, as you know, was our first year of doing farmers market. It's expanding this year. It's very exciting. The amount of farmers and farmers markets that we're getting on board right now, so you'll be seeing more coming out about that pretty quickly as well. And the one issue that I know a lot of you have been calling me about separately and has been in the news a lot is the Summer Electronic Benefits for Children program that's administered through our WIC program at Cherokee Nation within Public Health. And the Cherokee Nation Public Health is actually working closely with every school on the reservation. So the eligibility to have these benefits for summer EBT are that a student has to be enrolled in a school that offers the National School Lunch Program, and they have to be eligible for free or reduced lunches. Now, that encompasses a great deal of students across the reservation. And to be clear, we serve all students, not just Native students, but every one of them. And in that process, as we're working directly with schools, the USDA released what we call new interim federal guidelines this year, and we're trying to do what's called streamlined certification, so that we're taking the burden, hopefully, off the parent and guardian, so that if their student is enrolled in this process, they're already in a school that offers the National School Lunch Program, and they're eligible for free or reduced lunch, and we work directly with the school, they will be issued benefits automatically. So that's the process that we're working through. There will also be an application process come out that all of you will be seeing, that'll be on the Gadoogie portal. For those students who either get missed, maybe they moved into a school district late, or potentially the school decided not to participate with us, they'll still be eligible for those benefits. So I wanted to bring you up to date about that. That is a $40 per eligible child per month, so it adds up to $120 for the summer per child that we'll be sending out in the coming months. So, do I have any questions about any of that?
Carol?
Hey, Lisa. So if they're non-native, do they still have to fill out the application on the Gadoogie portal, or how is that going to work?
Right, so if their school doesn't participate with us and we don't get that information directly from the school, they'll have the opportunity to apply on the portal. And yes, native and non-native can apply, and then we'll be issuing the benefits. As you know, our numbers have greatly increased this year as the state of Oklahoma has opted not to offer this program to students in the state of Oklahoma this year.
Who? Okay, Victoria?
Thank you. Lisa, about the smoking cessation classes, does that include people that are vaping? Is the program the same?
Yes, we can include people that are vaping as well. Yeah, and there's also a lot of energy around campaigns for youth vaping. As we know from that perspective, that is a huge issue in our communities as well. So we're working on those at the same time, yeah.
Dora?
Hey, Lisa, thanks for all your help with that summer food program. And I think all of the schools in District 12 have reached out to you to participate. Do you think that's correct? I mean, do you have a feel?
Yeah, we have a pretty good feel for that, and we're
Yeah.
trying to help all of the schools right now with correspondence from the USDA, the Food Nutrition Services. So Summer Electronic Benefit Program is a part of the Richard B. Russell National School Lunch Program. So it's just an additional benefit. So the way the rules work are that if you're involved in that already, the school is able to share that information with other program aspects. So we're working with schools so that they're comfortable and they understand that they can share that information with us.
I really do appreciate that, and I cannot stress enough how important it is to get your schools to notify Cherokee Nation that they want to participate. Because if they do not, and a child has to go onto the Gadoogie portal, that information, that connection is going to have to come from the state. And it is crystal clear that our governor is not going to allow that to happen, which then would deny that child those services. So that's really important. Thank you, Lisa.
Yeah, we will be following up with each individual application just to verify eligibility, and we have a variety of sources that we're working with to try to ensure that happens for each child that might get missed through the, what we call streamlined certification process. Yeah.
So do we as counselors need to contact these schools to get to that, or are you doing that yourself?
We are doing that. We have got emails, we've got phone calls. We're doing direct conversation with both the food and nutrition coordinators at the schools and the superintendents of the schools, and helping provide them with the necessary USDA and food and nutrition service documentation so that they're comfortable providing us with those names and numbers so that we can get that out quickly.
Okay, one other question. With the farmer's market, do we have some way that if we're aiding in them purchasing food, that they use, the nation provides this fresh fruit for these people, or fresh vegetables and things at this farmer's market, or is it all just out of their pocket, or what?
So if you're a participant, if the WIC has a farmer's market, that is, they provide WIC participants with a dollar amount benefit for the summer. Cherokee Nation supplements that for this summer with another $150 for the WIC participants. So the farmer's market is offered through our WIC participants, and those benefits come through that. So they are actually receive, if you're a beneficiary on the WIC program, and that is both native and non-native, you will receive minimum of $30 benefit for the summer. But potentially, if you're a Cherokee citizen, you will receive another $150 to spend at the farmers markets. And the biggest challenge is, what I talked about earlier, is making sure we have enough farmers on, and we're really starting to see a lot more come about, and a lot more choices come about, and a lot more farmers markets this year. So it's exciting.
Thank you.
Mhm.
Belvina?
In Bernice, they're doing the raised bed for their, for farmer's market, and I think Cindy Tudor is going to be working with them, raising their vegetables and stuff. So would that count into as their farmer's market thing, if that's what they want to do?
Yes, so what we do is our WIC program goes out to make sure that we get the farmers on what we call a contract, or farmers on with us. There are some USDA guidelines around making sure that it's actually food that's being grown by the farmer, and that it's not secondary purchased out of state or somewhere else. So we do work through that process. It's pretty simple and pretty fast, so I'm sure that Cindy,
Cindy.
working with Cindy, we'll get it taken care of.
Okay, all right, thank you.
Junior?
What is the reason the school wouldn't participate in? What's the excuse they gave you that they wouldn't want to do that? That
Well-
makes no sense.
Well, potentially, I think this year especially with the new interim and final rules coming out, there's been some confusion just with schools around the legality of releasing that information to us, but that it's actually perfectly legal underneath the Richard B. Russell School Lunch Program for them to be able to provide that information as a supplemental benefit to that. And we're working with each individual school to provide them with that documentation so they feel. The only other issue might be that they are just us making sure we provide the support they need to get those data files transferred to us so that we can get that done in a timely manner. So I'm pretty confident all our schools want to help feed all our kids, as many kids as we can. So we're working as hard as we can to make that happen.
Mike?
So if a school participates in this program, they are basically given food, and they prepare it, and they can either come by and get it, or they can deliver it. Is that correct? I know that's how some of the schools, like during COVID, did. Is it kind of, would they approach that the same way?
Now, actually, what this is, these are electronic benefits just like the WIC participant would get on an EBT card.
Okay.
And they're able to actually go to the store and purchase food from our vendors, our WIC vendors. And there's a food package that's lined up that all the participants will know what they are. And they actually get to go and purchase the food themselves. There is another component of the Richard B. Russell School Lunch Program that I think some schools do elect to deliver, but I'm not positive of any of them that I've heard of doing it, with what you're talking about, which is called congregate meals.
I just like to, God, that's a big deal, that you guys have taken up, and it's so important. It just shows, that we are, it doesn't matter. We tend to do what's right, and you guys have shown that you have always been that way, and we'd just like to say thank you.
Yeah, I would like to, applaud our administration especially as well. I mean, the commitment to food sovereignty and to feeding kids on the reservation and feeding families. We're solidly committed to that across the board in every program and division at Cherokee Nation, so. Any further questions?
I have a question that shows my ignorance. Is the cessation treatment for vaping similar to just smoking, regular smoking?
It can be similar. It depends on, so a little bit about smoking cessation courses. Some of them are what we call over-the-counter pharmaceutical-based. Some of them can be in conjunction with their healthcare provider and have pharmaceuticals, and some of them are purely behavior-based. So it's a combination when they go into classes, and they're all in a class together, or we do one-on-one counseling as well. So depending on the issue that they're having, it depends on which strategy that might be used. So for instance, with vaping, it may be that there is an over-the-counter, if nicotine is in the vaping pen or the vaping device, or it could be that it is strictly a behavior change plan for them and support for that.
There's not much trouble with access to either one of those products, is there?
No, there isn't. No, we have access to those, yes.
Yeah. Any other questions for Lisa? Thank you, Lisa. Appreciate your report.
Thank you.
Appreciate Dr. Jones' report. Carl, appreciate you coming today. Yeah, I see no old business, no new business. There is one announcement. Do we have, the next meeting is scheduled for March 11th. Are there any other announcements? Entertain a motion, one more motion. All those in favor? Motion approved.